More than 29 million Americans have been diagnosed with diabetes. That's up 12% in just the past 3 years. And according to the CDC, people with diabetes are 2 times more likely to develop gum disease, which brings us to October, National Dental Hygiene Month. Our guest may be best known as the first female winner of The Amazing Race, but Dr. Natalie Strand is also a medical professional and one of the 29 million Americans living with diabetes. Today, she's taking us beyond the usual eat right and exercise conversation. Good morning, Dr. Strand.
Good morning. How are you?
I'm fine, thanks. We hope you're doing well, too. And I think we should start by connecting the dots here so our viewers kind of get it. October, National Dental Hygiene Month. How does oral health relate to diabetes?
Well, and I'm so happy we're having this discussion. As a woman living with diabetes and as a doctor, I know firsthand how challenging diabetes management can be. So I'm thrilled to be partnering with Colgate on this Small Steps Make a Big Difference campaign. We're really talking about things that are realistically infused into our lives. So as you mentioned, if you live with diabetes, you're 2 times more likely to develop gum disease. Most people living with diabetes don't know that. But something simple like brushing with Colgate Total twice a day can improve gum health in as little as 4 weeks. So there are really sustainable things, realistic things that we can do. And I encourage everybody to go to the website oralhealthanddiabetes.com for more information.
One of the keys to being successful on The Amazing Race is proper preparation. Can you help us take that idea and relate it to our general health?
Absolutely. Preparation is the key to everything with diabetes. So let's talk about sweets, for example. Don't make sugar the enemy. It used to be that if you were diabetic, you were told not to eat sugar, but the truth is, in moderation, with a plan with your physician and with regular physical activity, we can enjoy our favorite sweet treats, which I think is wonderful news since I have a sweet tooth. And, you know, even with exercise, we know it's good for us, but we have to plan for it. Too much exercise can lead to low blood sugar or hypoglycemia, so it's important to test before, during, and after exercise, and also to have a plan. Maybe you do it at the same time every day. Maybe you time it with your medication or your insulin, so that when you develop a plan, you can do it safely and avoid some of the common complications that people experience when they do activity or adventures with diabetes.
Let's talk about the disease itself and the consequences of not managing diabetes through lifestyle. What are they?
Well, as it was mentioned, I'm publishing a book out, and I have a whole chapter on diabetes from head to toe. Diabetes can touch almost every single system in your body: your heart, your eyes, your kidney, your skin, your hair, your nerves. But the good news is, with proper care, you don't have to suffer any of the side effects of diabetes. We can live very long, full, and healthy lives. So knowledge is power. If you know what to do and you can stick to it, then you can look forward to a very, very full and healthy life with diabetes.
And management between type 1 and type 2, is this idea of management just as important for both?
It's just as important for both. Type 1 diabetes, often insulin dependent in childhood diagnosis, although you can be diagnosed as an adult. Type 2 used to be called adult onset, but we're seeing it more in kids these days. With a lot of people, can be managed with just diet and exercise, but of course some people do need medication or insulin. So both of these conditions really require an active lifestyle, a balanced diet, a great relationship with a healthcare team, because you need to be able to ask questions and understand what the tips are. So for both of these, it's important to develop realistic, sustainable changes in your life that you can stick to over the long term.
Dr. Strand, is there a website where you would send our viewers if they want to sort of take this conversation to the next level?
Yes, if you have questions about oral health and diabetes, go to www.oralhealthanddiabetes.com.
All right, doctor, thank you for joining us today. It's nice to see you again.
Thank you very much for having me.
It's always a pleasure. Mike?